Hello world! Today we will talk about what is wrong with Andrew Yang's universal healthcare proposal. My name is Leon Neld, a hard sci-fi author. My novella, The Title Trigger, is available on the Amazon bookstore, link below. Recently, I have discovered Andrew Yang's interview with the Humanist Report, where he clarified his position on universal healthcare. However, what Andrew Yang had clarified could not resolve the problem that is plaguing basically every single healthcare system right now. So let's get to it. What is wrong with Andrew Yang's universal healthcare? Recently, Comrade Andrew, may I call you Comrade? I'm just gonna call you Comrade. So recently, Comrade Andrew had told a Humanist Report that instead of pushing for a universal healthcare, he rather offer a robust public option that will make privatized insurance obsolete. He proposed an ingenious way to accomplish this by adapting Medicare, which is currently only available to people over 65, to eventually include everyone. Why is this ingenious? Because it is easier to expand and adapt an existing network than to build a new one from the ground up. Some might argue that it's better to start from scratch. It is not so in this case, and here's why. First, we have to recognize that Medicare is region locked. What do I mean by region locked? Well, unlike physical products which can be freely distributed by trucks and trains, doctors and physicians can only serve locally. So to build a healthcare system from the ground up, the government must literally solve myriad logistical issues that comes with the vast territory. However, expanding Medicare's system to cover everyone like what Comrade Andrew proposed would be a more feasible option. So what is wrong with Comrade Andrew's ingenious idea? Well, Comrade Andrew mentioned that his parents were surprised by how streamlined Taiwan's single-payer healthcare system is. And Comrade Andrew believed that Taiwan is a good example of what a single-payer system can do. And they are right, because by some matrix, Taiwan's healthcare system is up in the top 10 along with Australia, Singapore, and Japan. However, Taiwan is a very different place. It's a tiny island about the size of Maryland where the population and medical resource are concentrated in three major metropolitan areas which allow better access and higher level of competition, both of which are very important for a healthy market. And there lies the problem with the American healthcare system. Doctors are localized and concentrated around hospitals so they can utilize the hospital's facilities. And hospitals are concentrated in the metropolitan areas. But US is a big place. I mean, it would be nice for the doctors to be evenly spread out around the country, but economics. Not only that, even though US has the same proportions of doctors and nurses to the number of patients, on par with every other developed nation, if most of the doctors are plastic surgeons living on the coast, it means that there would be a shortage of primary care physicians everywhere else. So the moral of the story is that US faces a set of its own unique problems that we need to solve ourselves. However, to solve any problem, first we need more data. Most politicians and pundits only use aggregated data to demonstrate the problem in the healthcare system, but aggregated data only shows the symptom of the healthcare problem and not the pathology. So no one really has a roadmap to solve this crisis. This is the same kind of problem that plagued the gender wage gap myth. The difference in pay between genders is only the symptom, but the root cause is not so much the hourly wage, but a more complex familial and social forces that's driving the difference. So the first thing that Comrade Andrew must do before he expands Medicare is to streamline information sharing across all parts of the healthcare system. All healthcare providers, insurance, and patients need to be able to share their data with the government. This information should include both ongoing treatments and its costs. And with this data, a standard measurement of healthcare and treatments for the new Medicare for All can be drafted and serve as a guide for its future. I mean, this might seem to be like a no-brainer, but there are still clinics that relies on facts. By establishing healthcare standard, we can identify shortfall in medical resources. For example, if we need more urologists to do colonoscopy, the government can incentivize more research and subsidize medical students in that field. If patients are using too much pain medication, Medicare can subsidize less addictive alternative like cannabis for pain management. All information must be centralized, monitored, and balanced by the government because the demand for life, a human life, far outweighs the supply. And thus, the market economy does not, and I repeat, does not function in the healthcare space. And the only entity that's not affected by the market forces is the government. And thus, the government needs to regulate healthcare by providing incentives and competition. Now, if this sounds like Big Brother talk to you, well, it is. Because Big Brother cares about your health. And as a staunch socialist, I love you, Big Brother. And I love you, Comrade Andrew. And that's my rant. Thank you for listening. And if you like this content, please subscribe and click the like button or leave a message below. And that's all, world.